the new DESE testing plan, which our doctors talked about tonight. We are just getting all the details. Tomorrow there will be a webinar. But as both our doctors said, this is really promising, and given where we are right now in the surge, this seems to make the most sense. And so we're looking forward to it. And certainly it will serve our staff and our students, the antigen testing that we'll talk about the testing plan tonight, our staff, our students, and next steps. So DESE this morning, the webinar tomorrow. In some, as we talked about earlier, these are take-home tests distributed to all students and staff. There's an opt-in, and certainly that's something based on our doctors reporting tonight that we would want to do. It also ceases the contact tracing and the test and stay program. Again, not mandatory. We heard all about that tonight, why that's so challenging. And there'll be more information once DESE shares details and determines operational pieces. And certainly we will be certain to consult with members of our medical advisory group should we have any questions moving forward.
Yeah, the last couple of weeks have certainly been challenging, given staff absences due to the pandemic. We've been able to continue staffing buildings safely and appropriately for learning. We've had an all hands on deck mentality, which has actually been terrific on the part of our administrators, our district-wide administrators, like our curriculum coordinators, really making sure that there's a strong person in each classroom, obviously maximizing use of our substitute pools as well. I think, many of the challenges, which I think mostly are self-evident, but it's helpful going into a little more detail just to understand, certainly with, there's always staff absences, particularly at this time of the year with the flu season in any given year. Obviously what we're seeing with COVID-related illness or the need for isolation or family members who are impacted of our staff, those absences are typically much longer. A 5-day minimum isolation is certainly helpful in that it gets people back within sometimes, over a weekend, less time if they're able. But we've also had, impacts on our substitute pool and those folks who are covering for absences as well. And it's really the volatility, the unpredictability of when folks are going to be out, not necessarily being able to plan for those absences, knowing that we might find out the morning of school, some of those absences that have been the biggest challenge, which is why we've used staff in a variety of different roles flexibly, and just very, very appreciative of this different staff members who educators have jumped into those roles, covering classes, teaching our young people. And again, in terms of volatility, it can vary greatly from school to school. We have a school that has a relatively small or normal number of absences on one day, while in another school there's a huge impact that comes out of the blue suddenly and then will wane over time. So those are just some of the dynamics that we're working with. But again, the good news is that we've been able to weather those storms and appreciate the all hands on deck mentality. The other challenge here is just, any given year we have some vacancies and some hiring that we do during the year, from maternity leaves, from other kinds of leaves or vacancies that may exist. And given the really tight labor market, the shortage of folks available to work in education for a host of reasons, the amount of time and effort going into filling those positions is very challenging for all of our administrators, for all of our staff involved in hiring. The HR department is doing an amazing job with recruiting, working with our partners in the staffing area, and getting our positions up and posted, and really scouring the landscape for folks. So we have a very good rate of filling those positions, and have lots of people in, but the combination of all those factors has certainly been a challenge.
I wanted to give you all an update on student information as well. With regard to student attendance, similar to staff, we're seeing that trend. Let's see, what's the right way for that to trend? We're seeing the numbers of absences trend downward. We did see about a 500 absence less between the first week of 500 fewer absences. How am I saying that? In the second week of January from the first. So that's trending in the right direction. I will say that from the elementary perspective, and I don't know if you're seeing this at all at the secondary, Toby, either, but we are seeing a number of absences that are due to caution and families feeling worried about their elementary children at school. They have not been exposed to COVID. They don't have COVID symptoms, but families are keeping students home out of an abundance of caution. And that is tricky in terms of making sure that our kids are being schooled and getting instruction. We are continuing to manage lunch with the guidance from the medical advisory group. We had a number of different protocols in place already. Schools are really diligent in terms of following through on those pieces. And across all levels, we when we do have students out, we work to support them through a variety of different resources dependent on the grade level. I will say that the shortened quarantine period has made this less stressful. When a student's out for 10 days, that can feel pretty significant. When students are out for maybe a couple of days or 3 days, we're used to working with students and families and catching students up if need be, as needed. And so that has felt more and more flexible as the change in the quarantine period was implemented.
I think finally, just some of the additional health and safety information that I think most of us are aware of. The plan to continue vaccine and booster clinics. I think someone, perhaps was Emily, asked earlier. I know our health and human service partners are working on plans for another booster clinics similar to the ones we had before the holidays. Obviously, the most important thing here is students and staff staying home with sick, as is always the case, as well as our other health pillars. As you know, after the return from break, we did tighten up many of our restrictions consistent with some of the guidance from MAG and other common sense restrictions around visitors, indoor field trips, assemblies, other large group gatherings, reinforcing proper mask wearing always. This is something that we really appreciate families' cooperation with getting your students ready in the morning, whatever age, making sure they have a proper fitting mask and understand that expectations. It's incredible amount of work, the constant supervision and correction that does need to happen in our schools, and appreciate the cooperation of everybody. We've already talked certainly about the new DESI testing program, as well as the ongoing work, and just continuing to monitor the health situation, being ready to make adjustments in the coming weeks, if there's areas we can loosen up, get more, for example, more fan and family access to some of our events, get students back into some of the extracurricular events that have been slightly curtailed or mostly continuing in a fairly routine fashion. We will consider that once we have that more information.